These are the diseases that doctors learn about in medical school. I know because I'm a doctor and I learned about them in medical school. But in fact, these diseases are actually symptoms of disease. The high LDL is not the disease, it's the symptom of the disease. The high blood pressure is not the disease, it's the symptom of the disease. The high blood glucose is not the disease, it's the symptom of the disease. The high uric acid is not the disease, it's the symptom of the disease. All of these are manifestations of dysfunction of cells in our bodies. And that's the disease, these abnormal pathologies that have basically sprung up and are being, have overtaken our general metabolism. I list the 8 subcellular pathologies that actually belie all of these chronic diseases. So, number 1, glycation. Number 2, oxidative stress. Number 3, mitochondrial dysfunction, which we've been talking about. Number 4, insulin resistance. Number 5, membrane instability. Number 6, inflammation. Number 7, methylation. Number 8, autophagy. Doctors don't get reimbursed for any of those. Doctors don't know what they are because they're not taught in medical school. Doctors don't know how to teach patients what they are, because why would you bring something up in a doctor-patient conversation when you don't have any answers for them? So like, why would you bother? So the doctors don't know, the patients don't know. And it turns out those 8 that I just mentioned belie all of those other chronic metabolic diseases. They are the ultimate manifestations of these 8 subcellular dysfunctions. In the book, I call them the hateful or grateful 8. When these 8 processes are working right, you'll be 110 playing tennis. When they're working wrong, you'll be 40 years old in a wheelchair with 2 stumps on dialysis waiting for your next stroke. And of course, everything in between. So fixing those 8 subcellular pathologies is what metabolic health is all about. The question is, how do you do it? How do you fix those 8? Real food is medicine. Processed food is poison. When you just say food is medicine, you're missing the point. It's the food that made the disease in the first place. So you have to understand that processed food is not food. And once you get that into your head, once you understand that Cheetos is not food, then all things are possible.